I'm not alone. I'm worth working on. I didn't know I could change pain. My pain is real. I'm not alone.
Let's talk about sex and sexual pain. Painful sex is too common an experience for women, and that's why it's so important to talk about it. Did you know that 20% of women aged 18 to 50 have chronic pelvic pain? And that up to 90% of women with chronic pelvic pain also have some type of sexual pain. In fact, some research studies have found that about 30% of women in general, so those who don't even have chronic pelvic pain, reported having pain during their last act of intercourse.
So sexual pain is really common. It can affect women of all ages. It can affect women regardless of whether their partners are men or women. And it can affect women right from the time of their first sexual experience, or many years later.
Painful sex is called dyspareunia. Some women feel pain with initial vaginal penetration. We call this vestibular, superficial, or introital dyspareunia.
And some women feel pain deeper inside, near the cervix. We call this deep dyspareunia. Some women have pain with penetration, some with climax, and some with arousal.
Many of our patients have pain due to a combination of all of these.
Some of the more common conditions associated with sexual pain are vaginismus,
Vulvodynia,
and vestibulodynia.
Vaginismus is the contraction or spasm of the vaginal muscles, making it difficult or impossible for penetration to occur.
Vulvodynia is pain at or around the vulva, and vestibulodynia is pain at the vestibule or the entrance to the vagina.
Both vulvodynia and vestibulodynia can occur all the time, which we call generalized, or only when provoked, when something is touching the area.
Women often find sexual pain to be a very distressing, isolating, and embarrassing condition, one that can affect their sense of self-worth and their relationships.
Some researchers say that with dyspareunia, deciding whether to have intercourse is like choosing between pain if you say yes and guilt if you say no.
Neither one is a comfortable option. Communication problems can be common because it's something that most people aren't comfortable talking about.
We also often hear about an all or nothing pattern where if we can't do it like we used to, I don't even want to try.
In this sense, women and their partners can sometimes just give up on trying to be intimate and grow further apart.
Common concerns that many women with dyspareunia have are:
will I ever be able to have sex again?
Is there anyone I can talk to about this?
I feel less connected to my partner.
Will my partner leave me?
What good am I?
There's nothing I can do.
We know that with the right strategies and treatment, sexual pain can be improved,
And in many cases, pain-free sex is a possibility. If this is something you want to work on, let one of your healthcare team members at the clinic know.
You can talk to us about it. Why work on sexual pain?
Well, did you know that sex is an important functional activity for all adults at any age?
Sexual activity allows us to connect emotionally, spiritually, and physically, not only to our partners, but to ourselves. Even if you've had problems with sexual pain or issues with your partner, it is never too late to start reconnecting with sexual activity, if you wish to do so.
Some things that can help to improve dyspareunia and improve sexual activity are:
use a good quality lubricant for sexual play,
each and every time there is penetration.
even if you think you don't need it.
We recommend water-based lubricants that are alcohol, glycerin, and paraben-free.
Try only pain-free sexual activity so that both partners can relax, enjoy pleasure, and know that pain will not be a part of the experience.
If choosing to have penetration, have high arousal before and during any vaginal penetration. This can improve pain with initial penetration.
It also helps if your partner is highly aroused as well, as this can shorten penetration time. Learn what arousal looks like for you. This may involve some self-exploration.
There are lots of resources that can help you with this.
Practice good communication with your partner so that you can let them know what works for you.
Relaxing the pelvic floor muscles during sexual activity by using the physiotherapy strategies that you learned at our program.
Use mindfulness-based stress reduction strategies to reduce tension and anxiety overall in the body.
Look at your self-talk, making sure that it's supportive, calming, and above all, self-compassionate.
The above strategies can help to reduce tension, anxiety, and stress.
Tension and anxiety are common when sexual activity has been painful in the past.
We call this the anticipation of pain cycle, where sometimes even the mere thought of sex leads to tension in the pelvic floor muscles and the rest of the body, along with anxiety.
The presence of tension and anxiety makes it difficult, if not impossible, to feel aroused.
This is because, as the Besson sexual arousal cycle shows, women start off in a neutral state sexually, and then depending on the stimuli, we can reach arousal and desire.
Once we feel arousal and desire and engage in a physically or emotionally satisfying experience, we get positive reinforcement to do it again.
This is a much more realistic idea of what sexual activity is really like.
Life isn't about having movie sex. We've all seen that on the big screen.
Fast or non-existent foreplay,
Immediate arousal,
always penetration,
and then mutual climax and drifting off into the sunset.
Well, guess what? That's not real, nor should it be. We prefer to look at life as having good enough sex.
Good enough sex is having realistic expectations with a flexible and creative sexual style.
It does not have to include penetration.
Nor does it have to include orgasm.
Did you know that less than 30% of women climax with penetration alone?
That means that 70% of more need some other form of stimulation.
Usually, that means direct clitoral stimulation.
And that also means non-penetrative sexual play.
Many women and their partners find that if they use lubricant,
Foreplay including clitoral stimulation,
and relaxation techniques,
they can have pleasurable sexual activity.
another key component to add is effective communication.
Research shows that the way our partners respond to us during sexual activity makes a big difference in how we feel about sex.
Did you know that when your partner asks,
"Are you okay?"
or "Does this hurt?"
it's actually not helpful.
instead of showing support, which was very likely their intention,
Those kinds of questions can make us pay more attention to pain.
and feel less desire and arousal?
Instead, try having your partner ask,
Tell me what you need.
or "Show me what works best for you this time."
Those kinds of responses, which we call facilitative responses, are shown to decrease pain and increase sexual satisfaction.
And finally, we recommend paying attention to all the other ways that you and your partner can connect.
It's not all about sex. It's really about emotional intimacy.
That's how we're wired as human beings, to
feel connected emotionally.
We often hear women saying,
If only this pain would go away, we would be fine.
"Don't put it off."
Feeling connected emotionally can increase intimacy with or without sexual activity.
Seek lighter moments, laughter, and activities that help you feel connected to one another.
Need more information or resources?
Talk to one of your healthcare team members at the program.
www.bcwomens.ca and search for pelvic pain and endometriosis.